I'm going to go really quickly because I think this is related into a little bit about trauma and treatment, and I'm going to talk a little bit about the problems on the treatment side again to this point because some of this also sucks. So hold that part. I'm going to tell you a little about the treatment. Some of you may know this, maybe you don't. But I'm going to end this part by saying, and this system's broken too in some ways. And so we're going to just go full circle. So on trauma treatment, couple of things to know. Of course, there's different types of treatment. Individuals can get support. There's group and family treatment. There's also school and guidance counselors. And I bring this up because it's important, because if you're supporting a youth and they are getting help from school, it's not the kind of help they would get from therapy unless they have in-school therapists. So just know that counselors, school counselors and counselors, or school counselors and therapists are not the same thing. School counselors really just focus on addressing the barriers to school success. They do brief stuff, and it's definitely not solution oriented as it relates to like healing and stuff like that. They don't do diagnosis, they make referrals. So just want to make sure, and that's important, because if we're supporting a youth and we think they have the support they need, they might not have it. So just knowing that difference is important. There's also support groups that could be available for them. The other important thing is that most of the time, folks don't get counseling or treatment right away. So what we see, and this is one of the sources for many of the world's problems. We're talking about gun reform. We're not going to go there, but I'm just saying, like, if folks were given an opportunity to get healing and get support for addressing their stuff, we don't get into, some of this other stuff, right? So, and I can tell you, whether it's as a therapist or in the coaching I do, folks tend to not show up until the SHIT hits the fan, right? Unfortunately. And so we tend to have adults and youth in front of us included, who have long-standing trauma that hasn't been addressed before we ever go get help or get an opportunity to get help. So it's very rare, that like something happens and then you get counseling. It's just not usually the case. Of course, medication is an option. I'm going over this medication, not because I'm a medication promoter, because I'm not. If you ever came to me as a therapist, I'm never starting with meds unless you are just so beyond where I can support you right now that the only way we could get started is to get you meds. So I'm not a proponent of starting with meds, but I do know for sure that meds work. I've used meds at points in my life, and I've had many clients be successful with them. It's important to also know meds are not a solution. No one should be on meds without being supported by a professional. I say this because, well, we'll get into a minute to talk about some of the issues with meds. But one of the things we do see is that a lot of folks, especially folks in minority populations, are scared of meds. And so I do want you to at least know meds are a thing. Meds can be helpful, but sometimes we have to support folks if they really do need meds and understanding, or at least getting the information they need to consider how it could be helpful. And I won't go too much in depth there, because again, this is not what you all do for a living, but just wanted to share a little bit of information about how that works. Some of the challenges, and you guys probably know this, again, when we talk about broken systems, we got a lot of mis and overdiagnoses that go on out here. These are 5 common diagnoses, especially with youth. And if you look at the list, these all look, and some of them look super similar, right? And so misdiagnosis happens just because we're not sure. Misdiagnosis also happens because of some other things that I'm going to get into. But misdiagnosis is a thing. So we can be advocates, at least, that if something doesn't seem right, we can at least be asking questions. Hold on one second, Heather. I'm going to get this last piece and then I'll get your comments or questions. On the treatment challenges, again, not every child receives counseling or adult, and not every child or adult receives good counseling, right? And I'm a therapist, I love my peeps, but just because folks are in therapy doesn't mean they're getting good therapy, just keeping it real. Some other limitations, if you have youth who are in a foster home, There are certain permissions that are needed. So you can have some issues if if the bio parent doesn't want to give permission, or, they got to argue back and forth between the bio parent and the children's services people. Wait lists are an issue. They were an issue before. They're super, super, super an issue now with COVID. Obviously, stigma is an issue, and that is especially the case with minority populations, lack of access and insurance. Many of the approaches, and quite frankly, the field itself is Eurocentric as heck. So it's not culturally responsive in and of itself. And when we say evidence-based, what does that evidence mean? Like, if you studied this med or this approach on primarily white folks, is it evidence-based? I mean, it's evidence-based for that population, but we tend to want to just use the evidence-based word just everywhere. We just want to throw it, like, what is it, Oprah's evidence-based for you, evidence-based for you, right? And so there's some issues there. And then, of course, the issue with acceptance in cultures. On the medication side, over-medication can be an issue. Some of the common issues that you can hear from folks about meds is, this makes me tired, this makes me feel sick, I'm gaining, losing weight, I feel dizzy, I don't feel like myself, they're not working. Sometimes folks, if you've been on meds for a while and then you just suddenly discontinue them, that is really, 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 really not good. And it can make you feel really crazy for a really long time. So if you have folks on meds, you need to make sure that you just support them and never, ever doing anything other than what's directed without talking to the person who prescribed it first, because there's some really serious stuff that can happen if folks just decide all of a sudden they're just not going to take the meds anymore. Another thing that I see that's just absolutely heartbreaking is there are a lot of pediatricians who diagnose kids early with like ADHD and stuff like that, and then put them on meds early as 4 and 5 years old. They never even see a behavioral health expert. And then the kids have been on meds from 4 or 5 years old all the way through like 13. So if you encounter them at 13 and they've been on meds their whole life, we don't even really know who this kid is, because this kid has never had a chance at life without being on meds. So I'm very, it's very concerning to me as a behavioral health expert to see how many pediatricians who are not behavioral health experts diagnosing and giving meds to youth without having them also being seen by a behavioral health expert. And I'm going to make a couple more comments, and then I'm going to give it, open the floor, because I know y'all got something to say. But I want to tell you why I'm noting this. One, because we're in position to support youth and families to have accurate expectations. We're not supposed to be experts, but it's helpful. The more you know about these systems and their brokenness, the better you can support folks themselves in having accurate expectations. The other issue is if you're not clear and you kind of assume, and you tell a parent or you tell a family or you tell a youth, oh yeah, you'll be going, once you go to court, you should get an answer next week. If you don't know that most of the time a court case takes a year to a year and a half or longer, then you accidentally have set them up with confusion and potentially re-traumatization, because you're making assumptions and throwing out some suggestions that are not necessarily accurate. So it's really important that we know our stuff, and every system is different. Your city, even city to city within a state, is different. So really, as much as you can, knowing how it works in your neck of the woods is important. It's also important that you understand the limits and risks among the systems, processes, and people, because again, we as mentors or folks who are working with youth in whatever role can like assume like that if a person is connected with said program, that the program's good, and the youth is trying to tell you, hey, something's not right here, and you kind of just assume that because they're in the system or they're with a professional that it's all good, and it might not be. So we do need to know that sometimes it's not good, or it's not a good fit, or the meds are a problem, so that we can be supportive. And then lastly, it's important because we need to know when to refer and who to refer to. Some of the conversation I had with some of your team a couple of weeks ago, there were a couple of comments about referring to children's services and losing trust, or calling the police and losing trust. So I just wanted to take a moment to note, we should be calling children's services and the police only when we have to, because those two systems, almost for sure, there's going to be some trauma involved, even if they're doing everything the right way. And there's just some undue trauma that doesn't have to happen if that's not the right phone call. So we really need to make sure everyone who's on this call, every team that's on this call, has relationships. And I know Jennifer has some things to add on this, has relationships. Some of you have, I think, in-house mental health folks or whatever, but you got to have relationships with other folks in the field, in your community, as your starting points, because unless somebody is abused and you know it, or somebody is at risk for something serious, the police and children's services should not be your first call, because it's just not a good starting point. So Jennifer, I'll give you a moment, and I know y'all got stuff to say. I'll be quiet so you all can give me your thoughts. Go ahead, Jennifer.
Yeah, thanks, Elizabeth. I think this last point is really important. And I just wanted to note that I think it's applicable to mentors too. I think sometimes mentors feel a sense of pressure that they need to resolve every situation, or they need to make things better, maybe have some kind of savior complex, when in reality, even really well-intentioned mentors, might not have the training or be equipped to handle these situations. And so having a list of referrals to mental health services is so important. I think some of the organizations on the call have in-house mental health services, but if you don't, I think it's a great idea to create a list of local resources and services that you can refer out to.
Thanks, Jennifer. And I'll be quiet and give you guys an opportunity to respond. Any thoughts on these? We're going to be wrapping up this section, moving on into the application of all of this stuff next. So just anybody, I know Tamara, you mentioned you guys are confirming in the chat, like, as I've already said, it's really heavy out here. There's not a lot of help available because the wait lists are so heavy. And again, folks are burnt out. So even when they do get to help, whether or not it's someone who's in the best shape to help them is questionable. So again, that's just us being there and being supportive is important. Anybody want to add anything or have a question? Heather, I know you came off mute. Let me just check back with you real quick.
Hi, thank you. Just adjusting my headphones. Sorry about that.
Okay, no problem. Anybody else, questions or thoughts?
I wanted to jump in, yeah. So I had a couple of things, just thinking about podiatry, doctors, and
yes,
like that field as a whole. I have two questions also. Let me start by that first. But I wanted to say, my understanding was that I thought they were like switching up the screening process so that they were doing more kind of cross-field conversations, and even like I thought the questions for mental health screening was more extensive now.
In theory, yes. I mean, is the field making progress? Yeah. How fast is it? You tell me how fast our system is, right? Like, we all know that there's some stuff we've been talking about doing better for a long time. So how that's actually playing out, I don't know right now. I also know that, like, so we can do an ADHD screening right now and just do the questionnaire. And then I could confirm, like, it doesn't take a licensed person to see you answered enough yeses, so it's ADHD. That is not the same as then providing the ongoing support, because like can they validate that there's ADHD present? Sure. But are they also then connecting them with someone who can look at supportive services and strategies that help me not just take meds, but learn how to add structure in my life so that I can manage my ADHD. Maybe I don't even need meds. Maybe my ADHD is such that if I use these things, I would be able to manage it without meds. So I don't know that I would love for us to get to a time where all of that thoughtfulness is being done. But when you also look at how overloaded our system is, everybody's just doing the best they can to crank people through. So that makes it even worse. So in theory, yeah, is it getting better? It doesn't change my point that we have an opportunity to advocate and keep an eye out because a lot of our people, our youth and families will not push back on a doctor, will not ask questions, will just go with whatever's told, will take whatever we're supposed to be taking, have no idea if that's a large dose or a small dose. Is this a start? So not that we need to know that, because that's not my point. My point is for us to just be aware that this is an opportunity for advocacy, to support in question asking, and support in going to find the peeps who do have the answers and do have the expertise to just double check. So love your optimism, and yes, in theory, but I don't know how much that's playing out. And what was your other thought or question?
Okay, I have one comment and then one
Mhm.
question. So my comment was kind of to, I think not Heather. Somebody had said this before, but just in terms of like, you don't got the answers, Sway, like, it's okay, you know, and I think it's like our ego gets the best of us. Like,
Mhm.
even when I think we're, as a youth worker, I think I like have a pretty understanding mind, and I'm not trying to always have the answers. And I think like one phrase that I use a lot is, you know, I don't know right now, but I could get you the answer. Because
Love
then
it.
that way it's like, it doesn't burst your ego too, you know, you get to have the answers, but they just
But
aren't
just not right
there.
now.
Yeah, exactly. So
I
I
love
think that's
that.
useful.
I
Mhm.
love that. Thank you. Good suggestion.
Yes. And then this is maybe unrelated to like work as a whole, but I have a friend who's currently pregnant who has like mental health. She's taking medications, and she's stopped taking meds in her like last trimester.
Mhm.
And all of us are kind of like pushing her, like, don't do that, because we're nervous for her well-being, but she's nervous for the child's well-being. And so I'm wondering, like, what is the long-term effects on a child whose parent was taking meds while pregnant?
I don't know that answer because that ain't my area of expertise. I'm not gonna have it
Sure.
tomorrow either, girl, because that ain't my lane. But my suggestion is always tell people to talk to the expert. Like if a doctor, ask the doctor, or
Yeah.
ask more than one doctor, right? If for all of any question, like ask the doctor, ask more than one doctor. There are certain meds that should not be taken while you're pregnant, especially in late med. So I don't know what the meds are, but it's going to always be ask your doctor. We should never be making medicine moves without the doctor because we don't know. And I'm gonna be honest, I took myself off meds once. It was traumatic. It was not good. I was very sick. Don't do it. I'm just telling you, because I literally know that this is not a good idea. So I don't know that answer, but I do know that we know who knows, right? So the answer is go to the person who knows.
Thank you.
Thank you, love.
Hallelujah. This is I just want to respond. I think that is relevant, your question about your friend, because we have teen parents here too. And, you know, those are questions that might come. I mean, I haven't had any teen parent telling me about their mental health and medication with that, but I know we have teen parents seeking for like help and services during their pregnancy as well. So it is very relatable to our work.
Yeah, and again, this is why we should never be acting like we know that answer or that we're even going to check on that answer. We're going to tell them that they need to go to their peeps. Even as a clinician, I am not licensed to discuss or prescribe meds. So as much as I do know, my answer is you need to talk to your doctor, right? That should be your answer. All your job is to do is to validate their concern and encourage them to get accurate answers. Support them in getting accurate answers from the person who would have the accurate answer. Got it? All
I
right.
have a question.
Yes.
So culturally, coming from a South American country, I know that we are like medication and therapists and psychologists are not our first like go-to. For our parents is always, you don't have anything, whatever. Yeah, right. For us, like personally, we had the psychologist and the therapist at school, like a counselor, but it was never like, oh, let me figure out what you have. No, nothing like that. So when the teacher was saying that maybe you were a little like weird or whatever, they get, okay, what do you have? What are you thinking? Like that was it. So I know most of our Latino communities here, at least, are very like proud, and they never want to kind of provide more information, and they will never want their kid like going and telling all the story and all the what they are feeling in front of a bunch of people. So kind of more than a resource to find a therapist or a counselor or whatever, is finding that information for another cultures to get more familiar with the benefits of having a therapist or a counselor talking to your kid about whatever they are feeling. Because I think personally and in my experience, like, it's not a thing. And if you come to a Latino community, a Latino family and say, hey, and maybe your kid needs some help with a therapist, they will be like, okay, wait, you know, like, I don't want that. I don't want our family issues just coming out for fun. So one of the big situations will be trying to find those resources in different languages and in those resources that can kind of teach the families and guide the families through the whole process, kind of starting from scratch. Like, how do you get families comfortable?
Well, and Maria, this is a good point, and you guys keep pulling. I feel like I should just skip ahead to this other part. And by the way, we're so behind, but I love it because we're talking and it's good stuff and we're learning. Let me see what we're working with here. Hold on one second. I'm trying to strategize. Okay, we can at least make it through that. All right, I'm not going to skip ahead because we'll at least make it through this really important part that I want to cover. I'm just going to say this for now, and then we're going to pin it because I'm going to come back to it. Maria, remind me. The boundary. I keep coming up with this boundary thing. We got to know our limitations, guys, and we got to do everything we can, and then know when we've done all we can. It's a horrible answer, but it's the reality, right? So quick answer for now on that is, again, what I already said. You guys have to do your best to always stay in relationship with the local peeps who are your go-tos, both generally and culturally, because to your point, referring folks of certain cultures to just any old counselor is not a good look. And you do risk losing their trust because you just threw them to whoever. So as much as you can, finding not only who you're going to connect them to, but finding folks who are culturally responsive and who can relate is critical. And you should be doing that. You should have those relationships already before the moment when you need to connect someone. And that should just be ongoing effort that you guys make to be in relationship with folks in the community who are your go-tos. Even like, so you can get that bat phone number, like, hey girl, I know y'all normally do this, but I really need to talk to you about so-and-so. You know what I mean? Just to do that relational thing, because sometimes that's what folks need. We're going to get, again, into that more, but I think one of the hardest parts about our work is that we cannot solution everything we want to. Even as a therapist, which I'm deeper, if I'm in a therapy role, I'm in deeper than you guys, I can't solution everything I want to. So we're going to talk about that more in a second, but yeah, and to your point, again, and to your point of later in adulthood, sometimes it just means it might not happen right now. It's not our job. Like, we're going to try to inspire folks, but we got to honor that people are where they are. And if folks don't opt into solutions that we would love for them to right now, then that is their choice. And we have to respect that. Even when we think it would be so helpful, it is not helpful to have somebody beating your ears up about how helpful a thing would be that you're not open to right now. Right? So sometimes we have to know that it would be really awesome if you would consider trying this thing. But if you've done your part, you got to know when to lean back on that, because you start becoming unhelpful when you are being overly helpful, if that makes sense.